Well, let's talk about erectile dysfunction, right? People don't exactly like to talk about that. It's not a popular conversation, especially for guys who experience it. And it's actually more people than you might think. 40% of men over 40 deal with ED in the US, and that percentage keeps rising, and the numbers certainly keep rising. Pills, injectables could offer some fixes, but it doesn't address the underlying cause. But now there could be a way to bring men all the way back to function for good. Today, I'm joined by Dr. Christopher Asandra, a renowned Beverly Hills-based anti-aging physician, and the CEO of EmCyte, Mr. Patrick Pennie. Gentlemen, thank you for being here. Cheers, mate. Good to see you. Pleasure. Good to see you, gentlemen. So, this is normally what men are sort of dragged in by their wives to talk to their doctors about, which I always find weird. I want to say this up front. It's one of the early presentation of coronary artery disease. So if men have erectile dysfunction and they're over 50, talk to your doctor. First, get a medical clearance. Right. And then there are things that can be done.
Doctor, you said it right. You know, the penis is kind of the window to the body. So if something's not working right down there, there's probably something else going on in the body, and you should definitely tell your doctor about it. There's a lot of different treatments options out there, like you're mentioning the pills, but what if we could take care of the problem at the source and start regenerating the tissue, the blood vessels, and the nerves to make it function again?
Patrick, that's where you come in.
So, you know, the parasympathetic nerve, it stimulates the cavernous nerve. Cavernous nerve, it releases nitrous oxide into the penis, and that causes vasodilatation, causes muscle relaxation. With the understanding of that pathology and that physiology, you know, when you're addressing treatments with this, you really have to address it, those particular points, the vascular part of it, and also the neurological part of it.
Okay, and what are you guys recommending?
We look at our monocyte-rich PRP. So that is a different type of PRP. We add a monocyte content to our platelet concentration. And basically what that does, it reduces the inflammation.
It's not something we were taught in medical school.
We're not.
How'd you find out about this?
Well, actually, meeting Patrick, you know, is just one of those type of regenerative therapies that we saw working well in joints for hair restoration, and said, why don't we apply this to the penis and see if we can, you know, get it functioning again. We
have a syringe. Are you using something this big for the PRP?
No, I just so you could see it well, but we actually use a smaller syringe.
And here's a
little model here. Yes, a little prosthetic. And as we know, the vasculature is usually in the shaft over here. Yeah. Okay, we use a smaller needle and we numb them up, make it very comfortable first. And then we inject along where the blood vessels and the nerves run.
So multiple injections?
Multiple injections on each side, okay? Because this is how our blood vessels and
nerves
nerves
You're putting
run.
it into the cavernous sinus?
That's correct, in the corpus cavernosum right here. You know, we see like a little disbursement of the PRP in that area to fix everything there, the tissue, the vasculature, and the nerves.
It seems to me like things like Peyronie's and stuff could be managed this way too. Is that true?
We actually do use it as a treatment for Peyronie's, which is curvature of the penis sometimes where we have scar tissue formation. We actually inject into the scar tissue to reduce scar tissue.
Well, that's the whole purpose of it. And that's why I talked about the monocyte-rich PRP. So the inflammation helps deal with the fibrosis. That is the scarring. So regular PRP won't treat that. So we've got to add another biologic to the milieu so that we're going to treat the scarring that occurs.
And how long before you start to see a sustained effect?
The regenerative effects come in the next month to 6 weeks, and then it kind of heals itself beyond that. But we do recommend probably, depending on the severity of their ED, multiple treatments down the line, and then some for maintenance as well.
And if men are skeptical or resistant, what do you tell them?
Well, I think it really depends on, again, the severity of it, but it's something that you should try to treat earlier than later because it's only going to get worse. If you start noticing the signs of it, talk to your doctor, talk to a regenerative doctor to kind of see what we can do to intervene early. One of the things I always promote is making sure your hormones are optimized too, right? Your testosterone levels are good because that helps with libido and blood flow down there.
Testosterone also, it kind of works a little bit like the biologic as well. It helps protect the nerves.
So embedded in what you just said was testosterone replacement if your levels are low.
Right, correct.
How do you determine, this is a question I get all the time, because men are all over the map from 200 to 1200.
Exactly.
How do you decide when somebody's low? It's just based on symptoms?
Yeah, it's usually based on symptoms. Listen, every man is different. You know, some guys feel great at 500, some need to be at 1200, like you were saying, in order to get over those symptoms.
I started complaining, I just wanted my urologist check it, 1280.
Wow.
Wow.
But I was complaining.
Wow, wow,
so
yeah.
What's going on?
And I have seen that. I have seen that
What
as well.
is going on?
So I've seen great performance at 400, 500. It's just really specific to
that. Tells me, Dr. Drew, maybe you were operating at 1500.
Right.
Yeah, I know. When I was a kid, it scares me a little bit.
Yeah.
Makes some sense. And
Well, good for you, though. Good for you.
That's amazing.
I really don't have any problems, but I was just like, oh, I check it. I was actually looking more for stamina for working out and things. I thought, I think I'm low. It's like 1280.
Wow.
So, well, gentlemen, thank you for bringing this to us. I think hopefully it'll interest some guys. And is it sustained once you've had the treatment? I mean,
Yes, it depends. Now, once this treatment's done, you need to start changing your lifestyle as well. You need to start getting healthier, eating, exercising.
Lose weight, exercise, yeah.
Lose weight, increase blood flow below the legs.
Okay, so if you'd like to explore more about these and other therapeutics, head to emcyte.com. That's EMCYTE.com. Stick around.